Hello and welcome back to Healthy Life Channel. Today, we're diving into a topic that might surprise you but is essential for understanding your body and health: the warning signs your armpits can reveal. Typically, we don't think much about our armpits unless it's related to hygiene. However, according to the Cleveland Clinic, this often overlooked part of our body can provide crucial warning signs about our health. Armpits are common sites for skin conditions and can indicate underlying diseases such as diabetes or autoimmune disorders. But before we delve into what your armpit tells about your health, if you're new here, show your support by hitting the like button, subscribing, and turning on notifications to stay updated on all our latest content. Welcome aboard. In this video, we will explore 10 warning signs that your armpits may reveal about your well-being. From changes in body odor to the appearance of lumps, visible veins, and other symptoms, your armpits can be a window into your overall health. Just a quick reminder: this video is for educational purposes only. If you have any medical concerns, please consult with your doctor. Let's get started. 1. Significant changes in size or shape. Significant alterations in the size or shape of the armpit area, such as visible lumps, noticeable enlargement, or asymmetry between the two armpits, could indicate the presence of unusual growths or swelling. These changes might result from benign conditions like cysts or lipomas, which are non-cancerous and often harmless. However, they could also signal more serious issues such as lymphadenopathy or tumors, necessitating prompt medical attention. Observing these changes early and consulting with a healthcare professional can lead to earlier diagnosis and treatment, potentially improving outcomes. 2. Unusual body odor. Have you noticed a sudden change in your armpit odor? Not the usual post-gym funk, but a distinct shift in your body odor. The armpit can be a window into overall health, remarks Dr. Jane Smith, a respected dermatologist. This change could be due to something as simple as a new diet rich in foods like garlic or spices, but it might also signal hormonal imbalances such as hypothyroidism. It could even be due to metabolic changes if you're undergoing medication shifts or other underlying health issues. For instance, a metallic smell might result from liver or kidney diseases. Certain infections or bacterial growths in the body can also manifest through unusual body odors emanating from the armpits. Diabetes patients might notice a sweet or fruity smell due to ketone production. It's essential to pay attention to these signs and consult a healthcare provider for a proper diagnosis and treatment plan. Before we move on to the next sign, we want to remind you to hit that subscribe and like button if you haven't already. Your support helps us continue creating valuable content for you. Now, let's continue with more warning signs. 3. Persistent lumps. An occasional bump under your skin after shaving can be normal, but a persistent lump, especially if it's growing or doesn't lessen over time, can be a concerning sign. These lumps could be benign cysts or fibromas, but they might also suggest more serious health issues such as tumors or lymph node inflammation. Swollen lymph nodes could indicate infections like mononucleosis or immunological conditions like lupus. Pursuing medical evaluation for a persistent lump or mass in the armpit area is essential, as this could potentially signal breast cancer or other serious conditions. Although the armpit is not the most common site for breast cancer to manifest, cancer cells can travel to the lymph nodes, making any unusual lump a matter of concern. Additionally, these lumps can vary in texture and mobility. For instance, a hard, immovable lump might indicate a more severe condition than a soft, movable one. Only a healthcare professional can accurately diagnose the cause of a lump through examinations and possibly imaging tests or biopsies. 4. Enlarged lymph nodes. Enlargement of the lymph nodes beneath the arm can sometimes be felt as a tender or firm area in the armpit. While often associated with transient infections like the common cold, persistent enlarged lymph nodes that are firm, fixed, or painless could indicate more serious illnesses such as lymphoma, leukemia, or metastatic cancer. Enlarged lymph nodes, though often indicative of minor infections, demand close attention when they persist or exhibit characteristics that are unusual for simple inflammatory responses. These lymph nodes might not only feel different to the touch but can also signal the body's efforts to combat more severe infections or respond to conditions where the immune system is compromised. For example, in autoimmune diseases like rheumatoid arthritis or HIV/AIDS, the lymph nodes can become significantly enlarged as the body reacts to its internal state of imbalance. Additionally, in diseases such as lymphoma, the lymph nodes themselves are the primary sites affected, leading to their noticeable enlargement. It's crucial to understand that while some causes behind enlarged lymph nodes are manageable or even treatable, others require immediate medical intervention to address potentially life-threatening conditions. Therefore, ongoing monitoring and consultation with healthcare providers are essential for anyone experiencing this symptom. 5. Persistent skin changes. While an occasional rash might not be a cause for concern, persistent changes in the skin of your armpit can be alarming. Discoloration, a lasting rash, or skin that suddenly becomes ulcerated without reason could suggest more than just skin irritation. For instance, certain types of skin cancer first appear as subtle changes in the skin, making the armpit a potential early detection zone for serious dermatological issues. It's also important to consider the texture and thickness of the skin in your armpit area. An increase in skin thickness or a bumpy texture may indicate underlying health conditions such as lymphedema, which can arise from blockages in the lymphatic system or after certain medical treatments like surgery or radiation. In some cases, the presence of dark, velvety patches in the armpits could be a sign of insulin resistance, a condition related to type 2 diabetes known as acanthosis nigricans. Early detection and management of these skin changes are crucial for addressing any potential health issues effectively. 6. Persistent armpit pain. Armpit pain is often dismissed as muscle overexertion or superficial scrapes. However, persistent pain without an obvious cause like injury or strenuous activity calls for attention. This discomfort could be rooted in issues ranging from soft tissue injuries and nerve problems to referred pain from breast conditions. Furthermore, the pain or discomfort experienced in the armpit area may be due to less common yet significant health concerns such as lymphedema, a condition often associated with cancer treatments that involve lymph node removal or damage, leading to fluid buildup and swelling. Additionally, consider unusual causes like hidradenitis suppurativa, a chronic skin condition that affects areas bearing sweat glands, including the armpits. This condition can produce painful lumps beneath the skin and significantly impact an individual's quality of life. Hence, understanding the underlying causes of armpit pain or discomfort is crucial for effective diagnosis and treatment, highlighting the importance of not overlooking such symptoms. 7. Persistent tenderness. An ache or sensitivity to the touch may seem insignificant, but when it becomes a constant experience, it's essential to investigate. Persistent tenderness could point to infections or inflammations indicative of larger health complications, including breast infections, especially in nursing mothers, or underarm folliculitis. Tenderness might be one of the early signs of a developing infection or inflammation, necessitating a closer look at one's health habits and potential exposure to irritants. Products such as deodorants or antiperspirants, often part of daily hygiene routines, can lead to skin irritation or allergic reactions manifesting as tenderness or discomfort in the armpit. Additionally, tenderness may also suggest underlying systemic conditions such as diabetes, where skin sensitivity and susceptibility to infections are increased. 8. Unusual bruising or bleeding. Bruising or bleeding in the armpit area can be a significant warning sign. Unusual bruising could be a sign of clotting disorders or platelet issues and underlying blood disorders. When bruising or bleeding appears without a clear cause, it's a warning sign that should never be ignored. This symptom could indicate more serious conditions such as hemophilia, where the blood doesn't clot properly, or von Willebrand disease, a more common but lesser-known clotting disorder. Additionally, bruises that are larger than usual, persist longer than expected, or occur alongside symptoms like fatigue and weakness could indicate an underlying issue with the bone marrow, such as leukemia. Consulting a healthcare professional upon noticing these symptoms is crucial for early diagnosis and treatment. 9. Visible veins. Visible veins that suddenly appear more prominent or swollen in the armpit area can often alert potential health issues that shouldn't be dismissed. These could indicate lymphatic blockage or the presence of tumors that are not yet palpable. In certain cases, such changes may also suggest an increase in blood pressure or alterations in the body's ability to regulate fluid, pointing to conditions like deep vein thrombosis, DVT, or other circulatory system disorders. Monitoring these symptoms closely and consulting with a healthcare provider to rule out serious conditions is essential. Early detection of these signs can lead to timely intervention and treatment, possibly preventing more severe health outcomes. 10. Persistent skin rashes or irritation. Skin rashes or irritation in the armpit area can have various causes, ranging from allergic reactions to hygiene products such as deodorants and soaps to more serious conditions like dermatitis or fungal infections. It's crucial to observe the characteristics of the rash, whether it's itchy, scaly, patchy, or discolored, as these details can provide valuable clues to the underlying issue. In some cases, a simple change in personal care products or wearing loose-fitting clothing made of breathable materials may alleviate the symptoms. However, persistent or worsening rashes warrant medical attention to identify potential infections or autoimmune disorders. Thank you for sticking around. If you found our video interesting, please like, subscribe, and check out our other videos on health and wellness. Your armpits might be telling you more than you think, so stay informed and healthy.